In January, Boston Indicators and Mass Inc. released Criminal Justice Reform in Massachusetts, a 5-year progress assessment. This was the first systematic look at the impact of two landmark criminal justice reform laws passed in 2018. Now, the goal for these bills was to shift focus and resources away from the most punitive elements of our criminal justice system and reinvest those into community supports and mental health treatment outside of prisons and jails. Now, the hope was that by doing these paired strategies, we could achieve something of a win win situation, both reducing our incarceration paired with reduced recidivism and crime. And this new report finds strong suggestive evidence that these laws actually succeeded in these efforts, though, of course, there remains much work to be done. Now, while we encourage you to check out the full report, here are 6 of our most important takeaways. We've ordered them along these lines. The first 3 are going to focus on incarceration and crime trends, while the last 3 focus on the promise of reform, that is, moving money from incarceration to reinvestment in communities. Finding number 1. Over the past 10 years, Massachusetts reduced incarceration at more than twice the US average, with outsized gains occurring since 2018. Number 2. In part thanks to increased emphasis on diversion, incarceration rates in Massachusetts fell faster than the national average for all races post reform, but the rate of decline was sharper for white residents. Number 3. With the notable exception of 2022, Massachusetts saw both property and violent crime fall steadily after 2018 relative to the nation. Number 4. Between FY 2019 and FY 2023, inflation-adjusted spending at the DOC and sheriff's departments fell by about 3%, which, while good that it hasn't increased, it's not necessarily the cost savings some might have envisioned. And due to declining populations, average cost per inmate actually rose significantly over this period. Still, cutting costs might be a little easier going forward as the state begins to shutter prisons like MCI Concord. Number 5. The state has made significant funding available for reentry programs and community investments that increase access to treatment and reduce recidivism. Now, to reach the full promise of reform, it'll be important to maintain these investments over the long term. But troublingly, we've already seen some effort to cut these new funds. Number 6. Less positive is the fact that the total number of state-funded inpatient continuing care beds has remained flat over the last decade. Facilities hosting these beds are increasingly used to treat the complex mental health needs of residents instead of prisons, but without increased capacity here, people are waiting longer and longer for appropriate treatment. Check out the full report on bostonindicators.org for more, where we also include recommendations on building on the progress that we've already achieved.